So in bipolar disorder, really what defines it is to some degree the hypomania or mania, because otherwise, if they're just having depressions, then we say you have recurrent major depression.
We most often see the first signs of bipolar disorder in late adolescence and more commonly in early adulthood. So sometime around 20 years old, we'll tend to see signs and symptoms. Bipolar disorder is a mental illness that involves both having had an experience of a manic episode as well as experiencing depressive episodes.
A manic episode is an experience lasting at least 1 week where a person feels really great about themselves, grandiose, even too great about themselves, if you will. They tend to need less sleep. They experience racing thoughts. They're more talkative than usual. They tend to be more outgoing than usual. And they tend to engage in a variety of different activities that have potentially painful consequences. So more activities involving drugs or alcohol or spending or sex or sort of frivolous purchases. All of these things are part of a manic episode.
The difference between more severe and less severe bipolar disorder is determined by the severity of the manic episode. So a severely manic episode would qualify for a bipolar 1 versus a hypomanic episode would qualify for bipolar 2.
So depression in bipolar disorder looks like major depression, unipolar major depression, which is usually a disturbance of sleep and appetite, either too little or too much. Feelings of sadness for most of the day, every day, with feelings of hopelessness, worthlessness, difficulty concentrating, something called anhedonia, the loss of pleasure in anything that you used to find pleasurable, and a lot of thoughts potentially about death or even suicide.
So what's really important to know about the diagnosis of bipolar disorder is to qualify for the diagnosis, you only need to have ever had one manic episode in your entire life.
The problem is that untreated hypomania doesn't stay that way. It dips quickly into either severe depression or mania with psychosis, both of which are dangerous states.
If you ever feel like you might want to harm yourself or somebody else, please call 911 immediately or proceed to your nearest emergency room. It's also good to have on hand the National Suicide Prevention Lifeline, which is 1-800-273-8255.